Ejaculation is often discussed only in the context of pleasure or reproduction, but biologically, it is far more than a sexual event. It is a coordinated health signal produced by the nervous system, hormones, blood vessels, muscles, and reproductive organs working in precise timing. When this signal changes in older age, it deserves attention not because desire has vanished, but because the body may be adapting or struggling to maintain balance. As men grow older, hormonal patterns naturally shift. Testosterone levels decline gradually, not abruptly, and this hormone plays a central role in semen production, muscle tone of the pelvic floor, and sexual responsiveness. When ejaculation volume decreases or disappears, it can reflect this hormonal adjustment. This does not automatically mean disease, but it does mean the endocrine system is influencing reproductive function in a visible way. Observing this change helps clinicians understand how the body is aging internally, not just externally. The prostate is another key contributor. It produces a significant portion of seminal fluid and helps propel semen during ejaculation. With age, the prostate commonly enlarges. This enlargement can alter the pressure and direction of semen flow, sometimes leading to weak ejaculation or retrograde ejaculation, where semen flows backward into the bladder. These changes are not random. They are mechanical and physiological responses that signal how the prostate and bladder neck are functioning together. Nerve function is equally critical. Ejaculation depends on intact communication between the brain, spinal cord, and pelvic nerves. Conditions more common in later life, such as diabetes, spinal issues, or long-term inflammation, can quietly impair these pathways. When ejaculation weakens or stops, it may be one of the earliest signs of nerve compromise, appearing before numbness or pain. In this way, ejaculation functions as an early warning system for neurological health. Circulation also plays a major role. Healthy blood flow is essential not only for erection, but for the muscular contractions that move semen. Cardiovascular changes, arterial stiffness, or reduced pelvic blood supply can diminish the force and effectiveness of ejaculation. This means that ejaculatory changes may parallel broader vascular health, offering insight into how well the heart and blood vessels are supporting pelvic organs. What matters most is understanding that ejaculation is not isolated from the rest of the body. It reflects overall system coordination. When it changes, the body is not failing, it is communicating. In older age, listening to these signals allows for timely medical review, lifestyle adjustment, and informed reassurance. Treating ejaculation as a health indicator rather than just a sexual outcome shifts the focus from anxiety to awareness, and from silence to prevention. Silence and avoidance often feel like protection, especially around intimate changes that carry embarrassment or fear. However, when it comes to absent or reduced ejaculation, silence does not preserve dignity or health. It quietly increases risk. The body does not benefit from being ignored, and medical issues rarely improve simply because they are uncomfortable to discuss. Many older men interpret changes in ejaculation as an unavoidable consequence of aging and choose not to mention it to anyone, including doctors. This decision may seem harmless, but it can delay the identification of conditions that are both common and manageable: prostate enlargement, medication side effects, hormonal imbalances, nerve changes, and metabolic conditions like diabetes often announce themselves subtly. Ejaculatory changes are sometimes the earliest and clearest signal, appearing long before pain, urinary symptoms, or sexual dysfunction become obvious. Avoidance also allows anxiety to grow unchecked. When a man notices a change but does not seek understanding, the mind fills the gap with assumptions. These assumptions often involve loss of masculinity, permanent damage, or fear of aging. Stress and chronic worry can further interfere with sexual reflexes, creating a cycle in which emotional tension worsens a physical symptom that might otherwise be mild or temporary. Another cost of silence is missed opportunity. Many causes of reduced or absent ejaculation are linked to medications commonly prescribed later in life, such as blood pressure drugs, antidepressants, or prostate treatments. Adjusting dosage, switching medications, or adding supportive therapy can often restore function or prevent progression. Without conversation, these simple interventions never happen. Lifestyle-related factors are also frequently overlooked when men avoid the topic. Physical inactivity, poor sleep, excess alcohol, smoking, and unmanaged stress all weaken nerve signaling, hormone balance, and circulation. When ejaculation changes are discussed openly, they often prompt a broader review of daily habits that affect not just sexual health, but cardiovascular and metabolic health as well. Silence removes this chance for early correction. There is also a broader health implication. Ejaculation depends on the coordination of multiple systems: neurological, hormonal, muscular, and vascular. Ignoring its absence means ignoring the performance of these systems as a whole. In some cases, early intervention can prevent more serious complications, such as worsening nerve damage or advanced prostate problems that become harder to manage later. Breaking silence does not mean panic or dramatic action. It means acknowledging a change and allowing it to be evaluated in context. A simple, factual conversation with a healthcare professional can distinguish between normal age-related variation and signs that deserve monitoring or treatment. Education replaces fear, and clarity replaces speculation. Ultimately, avoidance does not delay aging, it delays understanding. When men choose openness over silence, they give themselves access to reassurance, options, and control. Ignoring reduced or absent ejaculation does not make the issue smaller, it only makes it quieter, and quiet problems tend to grow unnoticed. Aging is often misunderstood as a process of loss, especially in areas connected to sexuality and physical function. This misunderstanding fuels panic when changes appear, even though change itself is not evidence of failure. In reality, aging requires adaptation, not alarm. The body at 50, 60, or 70 is not broken. It is different, and difference demands understanding rather than pressure. Many men measure sexual health using standards formed in their 20s or 30s. When the body no longer responds in the same way, the immediate reaction is fear or self-judgment. This reaction creates unnecessary stress, which can further interfere with sexual function. Performance pressure activates anxiety pathways in the brain that directly suppress the reflexes involved in arousal and ejaculation. What feels like aging is often the combined effect of biological change and mental strain. Adaptation begins with recognizing that the body's priorities shift over time. Hormone levels fluctuate differently. Recovery takes longer, and the nervous system becomes more sensitive to stress and fatigue. These changes are not sudden failures, they are gradual recalibrations. Understanding this allows men to respond with adjustments in lifestyle, expectations, and care, rather than with frustration or denial. The goal in later decades is not to recreate youthful performance, but to support current function. This means focusing on overall health instead of isolated outcomes. Regular movement, adequate sleep, balanced nutrition, and stress management become more important than frequency or intensity. When these foundations are strong, sexual function often stabilizes or improves within the context of aging, even if it looks different than before. Adaptation also involves redefining success. Sexual well-being in older age is less about speed, volume, or comparison, and more about comfort, connection, and responsiveness. When men release rigid benchmarks, they reduce anxiety and allow natural reflexes to operate without interference. This mental shift alone can restore confidence and improve function. Medical adaptation is equally important. As the body changes, health strategies must change with it. Routine checkups, medication reviews, and honest conversations with healthcare professionals help align treatment with current needs. What was unnecessary in earlier decades may become preventive now. Seeking guidance is not a sign of decline, it is a sign of engagement with one's health. Panic narrows perspective, while adaptation broadens it. Panic asks, "What am I losing?" Adaptation asks, "What does my body need now?" That question leads to practical answers rather than emotional reactions. Aging does not demand surrender, it demands awareness, flexibility, and self-respect. When men approach aging with curiosity instead of fear, they regain control. The body responds better to care than to criticism. By adapting expectations and habits to the present stage of life, men protect not only sexual health but overall vitality. Aging is not an emergency. It is a transition, and transitions are best navigated with understanding, not pressure. Action, in the context of aging and sexual health, does not mean rushing toward extreme solutions or reacting out of fear. It means making informed, deliberate choices that support the body as it changes. Education, assessment, and care form a practical pathway that protects long-term sexual and urinary health and prevents small issues from becoming lasting problems. Education is the first step because misunderstanding creates unnecessary anxiety. Many men are never taught how aging affects hormones, nerves, circulation, and the prostate. Without this knowledge, normal changes can feel alarming, while genuine warning signs may be ignored. Learning how ejaculation, erections, and urinary function are connected allows men to recognize patterns rather than guess causes. Education replaces myths with clarity and empowers men to participate actively in their own health decisions. Assessment follows education. When changes in ejaculation or urinary habits appear, a timely medical review provides essential context. This does not always lead to medication or invasive testing. Often it begins with a conversation, a review of symptoms, and basic evaluations such as hormone levels, blood sugar, or prostate assessment. These simple steps can identify reversible causes early. Waiting too long, on the other hand, can allow manageable conditions like prostate enlargement, metabolic imbalance, or nerve impairment to progress silently. Assessment also includes reviewing current medications. Drugs commonly prescribed later in life can influence ejaculation, bladder function, and sexual response. Adjustments in dosage or alternatives may significantly improve symptoms without compromising overall health. Without assessment, men may assume decline is inevitable when it is actually medication-related. Care is the ongoing response to what education and assessment reveal. This care is often practical rather than dramatic. Lifestyle correction plays a central role. Regular physical activity supports blood flow, nerve health, and hormone regulation. Adequate sleep stabilizes stress hormones that interfere with sexual reflexes. Reducing alcohol, avoiding tobacco, and managing weight protect both sexual and urinary systems by improving circulation and reducing inflammation. Informed habits also matter. Staying hydrated appropriately, not delaying urination regularly, and maintaining pelvic muscle awareness can support bladder and prostate health. Managing stress through structured routines or relaxation practices reduces nervous system overload that can suppress sexual function. These habits are cumulative. Their benefits increase over time. Care also includes follow-up and adjustment. The body continues to change, and health strategies must evolve with it. Periodic check-ins allow early detection of new issues and reinforcement of effective habits. This ongoing attention prevents crisis-based care and supports steady well-being. Ultimately, action is not about fighting aging but working with it. Education provides understanding, assessment offers direction, and care delivers consistency. Together, they transform concern into confidence. When men take timely, informed action, they protect not only sexual performance, but comfort, dignity, and quality of life well into later years.